About 3 days ago, I did a video asking questions about the Canadian healthcare system. If you haven't seen it yet, I got some really good responses from all around the country. Now, I didn't think we'd need this information this quickly, but it's there, so let's use it to debunk some of what Foodie's saying. Here's a snippet from her video yesterday.
And taking care of appointments and everything like that. I have a lot of appointments to do, and I'm running into a wall because the wait time, I called around, for most family doctors is like 2 to 3 years. I mean, that's where the healthcare system is failing. Right now, let's say at the Montfort Hospital, okay? Right now, I saw on the news, the wait time at the emergency is 20 hours. So, look, it's just, I don't know how long it's going to take me, and that's why I'm here indefinitely for now, because I don't know when I'm going to be able to get the healthcare that I need. And, you know, there's long wait lists, and I have a lot to take care of, so I'm just going to need to be here for a while. And, yeah, so it doesn't mean I'm not going to ever see...
Okay, Foodie, that's enough of that. Now, here are some of my favorite comments from my post 3 days ago. I'll just read you some of the highlights. I'm a Canadian and I've been a registered nurse for over 30 years. Here's what I can tell you as a patient and a 30-year Canadian nurse. She goes on to list the services that are covered under the public system and also touches on the private system where you can pay out of pocket for diagnostic services. She ends her comment with speculation that Foodie is likely going to see an urgent care physician because she doesn't have a GP. Remember, she acquired her medications in Kuwait, and she just had all of that lab work done. So she's really just looking to shift her care to Canadian providers. Now, this viewer currently lives in Alberta but used to live in Ontario, and they say that advocating for yourself is very important, and asks if other Canadians can stop going to the emergency room for minor ailments. They repeat that urgent care exists, walk-in clinics exist, and if your case is more urgent, they will send you ASAP to the hospital. Speaking of hospitals, on their websites, most hospitals also provide information for alternatives to the emergency room. This can include making an appointment with your family doctor, which Foodie doesn't have right now, going to a walk-in clinic, which she's very familiar with, consulting a pharmacist, or calling Health Connect Ontario. It's not like they leave you dangling in the wind. So now let's talk about eligibility. If you believe, like I do, that Foodie planned all of this, then she could have kept her OHIP current. This information comes directly from the OHIP website, and it describes how to make plans for when you're away for longer than 7 months. A Canadian viewer led me to this information by very astutely stating that while Canada knew that Foodie was in Kuwait, Ontario did not, or Ontario doesn't really care. To OHIP, she was just on a really long vacation. All she had to do before she left for Kuwait was go to a service center and present her health card and proof of residency. That could be something as simple as a valid driver's license. And while she was gone, Foodie was considered a factual resident of Canada for tax purposes, and that just means that she had certain ties. For example, she could have said that her home was at Smee's house or with Auntie Phyllis, and her second residential tie could be the Kia, just sitting there waiting for her. So all of this could have been planned out before she even left Canadian soil the first time. Now keep in mind, with an eligible OHIP card, she could have been making appointments while she was in Kuwait. Think about it. If you go on vacation somewhere, say for 2 or 3 months, right? And you want to see a dermatologist when you get back, what stops you from making an appointment online to see a dermatologist for a date when you know you'll be there? Nothing. The answer is nothing. Nothing was stopping her from seeking her health care. In my opinion, Foodie is going to try to spin this health arc all different sorts of ways. But what she doesn't realize is that there are a lot of really smart viewers out there, many of them who live in Ontario. If you haven't checked her out yet, go to Kidney J's page. She's a Canadian who talks quite a bit about their healthcare system and her experience with dialysis. I'd like to leave you with at least one reminder. Your healthcare is your responsibility. Your medical records are your responsibility. You can seek and get medical treatment anywhere you want. Foodie could have gotten it in Thailand. She could have gotten it in Kuwait. Wait, never mind. She did get healthcare in Kuwait. She has a doctor's plan. She's just ignoring it. She was given medication, which we don't know if she's still taking, and she just had recent lab work done. So whatever you believe, whether she still has OHIP or not, whether she understands that she can go to a walk-in clinic or not, it's up to you. Take anything she says with a grain of salt. Just try not to exceed 1,500 milligrams a day. Drop me a line in the comments and let me know what you think about all of this. I'd love to hear from you.